So the students have been wanting to become more involved with the pandemic. A lot of their clinicals have been affected in one way or another by the logistics and the surge in patients that a lot of hospitals had. So because of that, for a while they said no students, allowed. So things like this, where a student can spend 7 hours giving shots and learning about the logistics of how do you set up a vaccination clinic like this for my community students. I know that this has been really experiences that they're not going to have in their lifetime again, or at least I hope they're not.
Our jobs here can be anywhere from actually giving the vaccines to the community. We can also be at the consulting tables, going through their paperwork, making sure they're fit to get the vaccine, and observing them for 15 minutes after they get their shot, or filling the vaccines, some things like that.
So it's a very interesting time to be learning about public health, especially with these vaccine rollouts, and constantly learning and changing with this pandemic as guidelines change, as what we know about the virus changes. And so as a student, I'm constantly learning how to learn. I'm used to opening up my textbook or reading resources, but I've really had to do a lot more research on my own about okay, when people ask me questions, I can't just be oh, let me go flip through my textbook. I have to be well, according to the New York Times or this, I have to really be on my game a lot more. And I think it's really helped me in my own career. And I think it's gonna help me going forward.
PLU is here to take care of our community. And I think that by offering our resources in both personnel and then also facilities. I think that this is exactly what we need to do to help our society and our community come back to normal, or as normal as we can.
Something that we really strive for here at PLU is therapeutic communication. So something that has been really hard throughout this pandemic is making sure that people feel safe and that they feel healthy, because it's this constant state of unknown. I've really taken therapeutic communication to another level to really assess where people are sitting with themselves and sitting with this whole process. And you can tell when people come through that they're nervous, they're scared. And so getting them to open up and really using your resources to gauge their level of understanding and to give them empathy and see where they are. It could be just cracking a couple jokes can really honestly brighten people's moods, and it makes them feel more comfortable with you. I am a third-generation PLU student, and I have known that I wanted to come here since I was 16 years old, and I am so blessed to be able to be a part of this program. So I am just so incredibly happy to be in this position that I am right now and sharing it with others.